Welcome, Dr. Bazron. How are you?
Yes, thank you so much for having me. I am so excited that May is Mental Health Awareness Month. However, every month should be Mental Health Awareness Month. And I think I just want to make sure that our listeners understand that there is no health without mental health.
Mm.
Mental illness can impact anyone, regardless of your age, your economic position, your race, your ethnicity, where you work, and so forth. And so it's really critically important for everyone to learn about the signs and symptoms of mental health and the resources that are available to address them. Learning these things can really help you respond with empathy and confidence to people you love or even to yourself.
Dr. Bazron, I want to ask because, we are hearing a lot. There are more conversations now about mental health than, let's say, in my growing up. Now it's a big conversation, but it seems to come at a time when a mental health crisis has already occurred, and either from a public safety standpoint or domestic violence standpoint or whatever, people are now saying, oh, people really need to reach out to get help before there's this crisis. Um, but how do people find that help?
Well, we are so lucky here within the District of Columbia that our mayor, Bowser, has really invested in mental health services and supports. It is very easy to get services. People can simply dial 988, which is our mental health crisis lifeline, and get the services that they need. Now, you can call, or you can text, or you can chat to get that help. And when you reach the 988 line, what you will be, the phone is answered or the chat is answered by a mental health professional that can really talk to you and help you identify what services and supports are needed and then connect you to those services.
Some parents, I guess, or in some households, their children, right, who are in need of services. There are school systems that recognize that children, some of their students, may need some of those services. How do you link that to that generation of folks? I mean, it's good to be able to call a number,
Sure.
and I'm so glad that you all have this number. We're going to put that out there again. But, the range of individuals who need mental health services are from, like little kids, I say, to seniors. So how do we address their needs?
Well, first of all, I really want to dispel a myth.
Mm-hmm.
And the myth that you hear often is that children don't experience mental health issues. They do. They experience those the same as adults. And so, how would you, as a parent or a caregiver, know whether or not your child might be experiencing a mental health issue? You might see a sudden change in mood of a child. A child who was always happy go lucky now becomes sullen and quiet. You may see that the behavior changes in the child. The child is lashing out, is angry, is fighting. You may see that there is a lack of maintaining physical habits. That child that was very neat wouldn't walk out the door to school unless everything was tucked in and so forth, now goes and things are just all over the place. The other thing is we have to be very aware when children begin to withdraw from social contacts. They stay in their room all the time. They don't want to talk to their friends. They don't want to talk to family. Uh, they have mood swings, and they're really beginning to express feelings of hopelessness. And so parents will hear that their child doesn't have any energy to do anything, always feels like depressed, always feels that there's just nothing that they want to do. And those changes really signify that something is going on. Now, for young people, I want parents to know that the Department of Behavioral Health supports school-based behavioral health services in all public and public charter schools. And so young people can get those services where they are all day in school
How
from
did
a certified clinician.
so is there one in every school? Is that what you're saying?
There are services in every school. And
Interesting.
there's a team. Some of those clinicians are clinical staff that the school may have hired. Others are clinicians that DBH has hired.
And does it require any kind of parental consent before a child can actually be seen by a school clinician or to access those services?
Yes, we offer, first of all, there's a range of services that are offered. We offer prevention services, and that's very important because we really want to focus on the resiliency of young people and help them with healthy decision making before they get to the point where there's an issue. All of the young people can receive that service. We also have intervention services, which means that a mental health professional is observing what happens in the classroom, in the hallway, in interactions, and can identify those young people who may need some specific services and supports. If that child needs treatment services, that clinical treatment, then parents and caregivers are involved and need to provide the approval and the consent for those children to receive those services. And I really do hope that that family members do that. There are some instances in which young people can assent to services, but we really want parents to and caregivers to consent because children exist within their families and within their communities, and
Right.
the parents are very important pieces of that.
Right. I'm so glad we, sort of nailed in on that because I think that is something parents need to know. But what are some tips also that you have that that self-care tips
Uh-huh.
that people can use to maintain balance and mental wellness?
First of all, I think that all of us are responsible for our own mental wellness. You can't help others unless you take care of yourself. And I'm going to give you a few tips that I have found to be important. The four M's of mental wellness are movement, exercising; mastery, doing something that you like to do, something that brings you joy; meaningful engagement, staying connected to the people in your life. Those social connections are so important; and mindfulness, and that includes everything like breathing exercise, relaxation exercises, and so forth. For many people, connecting with nature helps. One of the things that I think that we all need to do is maintain a healthy diet. That's very important to our mental wellness. And also, one of the things that we often overlook is the need to get a good night's sleep. Adults need 7 to 9 hours of sleep every night, and children need 9 to 11 hours of sleep every night. And sleep is restorative. That's when our body rebuilds itself and replenishes itself, so it's important. The other thing I suggest is setting healthy boundaries. Do what you can manage. Don't overpromise and underdeliver because then that creates stress. No is not a bad word to set those limits. And then lastly, everyone should do things that bring you joy. If you feel that there is a need for any kind of mental health support, please do not hesitate to contact our department at 988. You can text, chat, or call for confidential mental health support 24/7. Around the clock, those lines are available. And I think that that is so important. It is free and it is confidential. But once again, I just want everyone to know that if you have a mental health problem, you are not alone. Health help is available. You do not have to struggle alone. So please do not hesitate to contact us. And I want everyone to mind their mental health. I want to thank you today for giving us this opportunity to share information during Mental Health Awareness Month.
Well, I certainly didn't have to ask any more questions, although I have a lot left, but I know have run out of time. But I think that message was very clear, and hopefully people will get that, and we will continue to promote this 988 number, Dr. Bazron. I appreciate you being with us to share this important information. And like you said, Mental Health Month is maybe the month of May, but good mental health or addressing mental health is something we do 365 days a year, should be said. So
Absolutely.
thanks so much for being with us.
And thank you for having me.
My pleasure.
And mind your mental health.
Yes, yes, yes.
Okay.
Yes, yes. Thank you.
Where do you come to get